so much, Alyssa. Great partner working with us. I'm so pleased to introduce Joan Quinlan, who I have known well for just a few decades. And it's just been, this is really a pleasure. Joan is the Vice President for Community Health. She's led the MGH. She has led the MGH Center for Community Health Improvement and its predecessor, the MGH Community Benefits Department, since 1995. Prior to joining MGH in 1995, Joan was the Administrative Director of the Boston Healthcare for the Homeless Program and the Advisor on Women's Issues to Massachusetts Governor Michael Dukakis, which is where we met when we were about 8. And she was, this is not in my remarks, but I have to say that she was instrumental in helping to launch what was became now the Governor's Council on Sexual and Domestic Violence. And so she was the first staff person who started a very long path toward that kind of a important group in the Commonwealth, and an unusual group. And so I'm just very pleased to have the honor to introduce Joan. Thank you so much.
Debra stole some of my better lines. It is my pleasure to introduce Matt Fishman to you. And at some point, you do realize you're asked to do these things because you've been around the longest. It's a polite way of saying you're the oldest. And I have known Matt for 3.5 decades. So I want to tell you how I've known Matt. And as I do so, think about, I'm one person. There are hundreds, if not thousands, of stories like this about how Matt has changed lives throughout the city and the state. So I first met Matt in the early 80s when I was in the governor's office. Matt was I think right out of college, budget director for what we then called the Department of Public Welfare. He was really young, but I also learned that there was no better ally in making sure that every dollar in that Department of Public Welfare went for the best possible use to help women and children. Then in the early 90s, when I was at Healthcare for the Homeless, in the meantime, Matt had served as Undersecretary of Health for the Commonwealth, then an administrative fellow at Brigham and Women's Hospital, and he was then the director of the emergency department. But he was much more than that. Matt has always been one of those quiet, behind-the-scenes, highly effective players who makes good things happen. So at Healthcare for the Homeless, we were struggling with how to open a step-down unit for homeless people who had been acutely ill. It's now known as the Barbara McGinnis House, probably many of you know it. But we were so stuck with a million bureaucratic administrative barriers. We went to Matt and asked for his help, and he convened hospital leaders, state agency heads, and one by one we solved all those problems. The fact that McGinnis House exists today is in no small measure a credit to Matt. And then 22 years ago, I had the opportunity to do community health work at Mass General, and part of the draw was that Matt was at Partners doing the similar work. And Matt, from the very beginning, has always gotten that domestic violence, sexual violence, is a healthcare issue. And that healthcare needs to address it and needs to partner with the community really to get the job done. That commitment has only deepened over the past 22 years. He's instrumental in Passageway at Brooklyn Brigham, the Haven at Mass General, and the program at Newton Wellesley Hospital. So Matt is a visionary, really. He is earnest, sincere, committed, tireless in his work for social justice, economic equity, and a world without violence. He has the same zeal for the job now he did 35 years ago. Think of him as a colleague, a mentor, and a friend who has made all the difference to the community and to thousands of people. And so it is such a pleasure to introduce Matt for this award. No one deserves it more.
thank you very, very much. It is wonderful to be able to work with you every day and see what we can do to keep moving the work in the right direction. And that was a really very kind introduction. I also want to thank Debra and the Jane Doe board and team for this powerful recognition. It is really very moving to have this happen. And I want to accept this award on behalf of the advocates, social workers, nurses, program leaders, and physicians in the Partners Organization who work every day with patients and employees who are survivors of domestic violence and sexual assault, and who do that work in close collaboration with community-based service providers, including many of the people here today. The hospital and community health center-based work is important, but as important as it is just one piece of a much larger system and movement for change that all of you have created and strive to maintain and advance every day. Thank you all for everything that you do. So just a minute of history. 20 years ago, the Brigham and Women's and Mass General Hospital domestic violence programs were new. They and the Newton Wellesley program have since become core elements of the community health commitments with which the Partners hospitals make. How did we get here? And what does that journey tell us about the future of this work in healthcare? We got here by listening to and acting on the voices of survivors, patients, caregivers, women, and a few men who use their voices to hold institutions accountable. The 1990 Boston Globe series on racial disparities in infant mortality, written by Dolores Kong and Eileen McNamara, changed healthcare in Boston. The series enabled women, including African American patients and nurse midwives, to make it clear to the white male power structure that African American infants were dying at a vastly disproportionate rate. And, as the Globe pointed out, were dying almost literally in the shadows of the renowned hospitals in which these infants had been born. The Brigham was and is the largest birthing hospital. Our children were born there, I was born there. One of its leaders told the Globe in 1990 that the Globe was not, pardon me, get that right. One of its leaders told the Globe in 1990 that the hospital was not accountable for anything that happened outside its campus. Only what literally happened when the woman and the infant were in the delivery room and immediately postpartum. The rest of it, somebody else's problem. That comment was a catalyst for change, especially juxtaposed with dead infants. Many African American infants were dying because their mothers entered pregnancy already carrying significant health problems due to racial disparities and gaping holes in the health and social services systems. In other words, there was a serious women's health problem, completely independent of reproductive status. Making progress would require acting on all of the factors that matter in women's health, including intimate partner violence. And if I remember correctly, this is around the time that Jane Doe began its work as well. In the years following the Globe series, thanks to advocacy from social workers and nurses, Brigham and Women's committed to training caregivers to screen for and respond to domestic violence, and the hospital committed to hiring advocates. A few years later, these commitments became the Passageway program. And after the Brigham and the MGH came together to form Partners, Joan Quinlan, working with Isaac Schiff, got a similar commitment from the MGH to begin the Haven program. Our employee assistance and Newton Wellesley commitments followed and have also made a big difference. I can also put this in more personal terms. I remember in 1990 observing care one evening in the Brigham Emergency Department when, as Joan said, I was an administrative fellow. A female patient came in with large bruises and was clearly very frightened. She said that she did not want to be examined by male physicians or male nurses. The response of her caregivers that evening was to disregard her wishes and also call for a psychiatric consult. Let's contrast that with 2016, during which the Partners Hospitals provided individualized care to more than 2,300 survivors of domestic violence and sexual assault. And sadly, that brought the total we have served in the last 20 years to nearly 25,000 survivors. At a time of enormous change in healthcare, our priorities are to maintain these programs and to continue to strengthen our collaboration with community providers, a collaboration that I know Tina Nappi from Jane Doe is very involved in. And of course, she goes back a long way on this work with Rick. But is that commitment to maintain our programs and strengthen our collaborations with community providers, is that enough? What happens to the domestic violence and sexual assault survivors after we see them as they go forward in their lives, and to the children of these survivors? What about the very large number of adults who have experienced violence and other trauma in their lives, may not have received care for that trauma, and are carrying that physiological and psychological burden throughout their lives? If we believe that the best, most effective healthcare is informed by and serves people as whole individuals, what do we need to do? Well, first, let's continue to listen to patients and survivors. What do domestic violence and sexual assault survivors want and need from us in the healthcare system? And second, let's figure out a way to recognize and act on the disease burden that untreated trauma creates for a population of women, men, and children. Our hospitals are in the early stages of that work, introducing trauma-informed care and collaborating with Jane Doe in that effort. Already stretched hospital and community resources may mean some caregivers will worry about how to respond if patients disclose significant trauma history. But there is still much that caregivers can do that would be effective. They can learn to inquire in a trauma-sensitive way about a patient's history, and then to listen respectfully and empathically to how a patient decides to proceed. We need to work with everyone in the room to deepen this effort, to continue to transform the way healthcare providers offer clinical services, healing, and hope to survivors of domestic violence, sexual assault, human trafficking, and other trauma. We need to get upstream on these problems by supporting the work Jane Doe has underway on prevention, and by expanding prevention efforts that the community providers in the room and our hospitals also have underway. We look forward to working with you to make this vision real by building on what Jane Doe has done for so long, catalyzing stateless, very moving and inspiring recognition, and for the energy it will provide as we go forward with the work. Thanks very much.